You have a lot of belly fat and loose skin. You have been dieting, you have been going to the gym, and you've been trying everything to lose this, but you still can't get rid of it. Well, in this video, I'm going to talk to you about what this loose skin and fat is because of, and why is it not responding to diet and exercise, and what you can do to eventually lose this and look better. Hello, my name is Dr. Arjun Handa, and I'm a body contouring surgeon at Handa Aesthetics. So let's first understand why we develop loose skin and some diet resistant fat in our body. So after pregnancy or after having a lot of fat and weight on our body for a long period of time, what happens is that our muscles and skin get stretched. So this leads to the skin losing its elasticity because some of the collagen and elastin fibers in the skin get damaged and hence they are not able to retract back. You can understand this by comparing it to a stretched out string or a rubber band. When you stretch it beyond a point, it just fails to return back to its normal position. Now, this is important because once the skin has been damaged, no amount of diet, no amount of collagen, protein, exercise is going to fix that. You can lose the fat in most cases by diet and exercise, but you cannot correct the skin. Now let's come to the second part of fat, which is resistant to diet and exercise. So if you've had a lot of fat on the body for a long period of time, that fat can cause inflammation. And these inflammatory markers in turn cause some fibrosis around the fat, and this fat can then become a little harder, and that is what we called as lipodystrophy. Sometimes it happens on a specific area of the body, so then we call it a focal lipodystrophy, or it can occur all over the body, then we call it a generalized lipodystrophy. So this fat is usually hormone dependent, it is usually resistant to diet and exercise, and it's a little firmer than your normal fat because of the excessive chronic inflammation and also fibrosis occurring around this fat. So the only treatment for such fat is usually liposuction. Although it may seem like a cosmetic and an unwanted procedure, but the treatment for conditions like lipodystrophy and lipodema is actually liposuction and nothing else. Now let's come back to the third point where I said that pregnancy and excessive weight gain can also stretch your muscles in the abdomen. Now these muscles also stretch out, and again the central part of the muscles, which is actually called the linea alba, stretches out and becomes dysfunctional. So this causes the tummy to protrude out. Now this condition is called diastasis recti. There are many grades of diastasis recti. So minor variations can be corrected by diet and exercise, specifically core engaging exercise. But for severe rectus diastasis, or where people cannot do core exercises because of some physical limitations, again, a surgical correction is required. But for that, to correct that problem, the patient should be thin enough to begin with. So diet and exercise remains an essential component of treatment of rectus diastasis by surgery.